Hi, I'm Grant.
And I'm Kathy. Welcome back to our Change How You Think weekly video podcast.
If you'd like to hear from us every week, then subscribe to our video by clicking on the weekly video tab at the top of this page. Fill in the subscription form and you'll get our free ebook, Healthy Moods.
This week was the annual Blue Monday. It's the third Monday in January, which is considered the most depressing day of the year in the Northern Hemisphere.
There's nothing scientific about it. They arrived at the date, I think, because the days are short, the holidays are over, winter is dragging on, and the credit card bills are arriving. But it gives us an excuse to talk about mental health this week. Last
week, Mental Health Research Canada released a snapshot of Canadian mental health during the pandemic.
It found that 22% of surveyed Canadians had been diagnosed with depression, and another 20% said they'd been diagnosed with anxiety. Both of these rates are the highest ever seen by this organization.
Drug insurance claims for antidepressants were up 17% in 2020, and the number of people reporting feeling anxious or depressed, but without being diagnosed, was also at an all-time high.
36% said working from home was more stressful and that the social isolation has hurt their mental health.
Another disturbing finding was that people are not going for help because it's now so difficult to see a mental health professional. So, as the rates of suffering are going up, the number of people getting help is dropping.
Those who were feeling depressed and anxious also were less likely to accept the vaccine. So their mood was interfering with their ability to accept the solution to the pandemic.
If you are feeling down and anxious and can't seem to shake it, talk to someone. Start with a friend or family member. We're all feeling cooped up and frustrated, so I'm sure you'll find a sympathetic ear.
If that doesn't help, or you feel yourself getting worse, then you might need to talk to a professional. Start with a counselor. Most of them are now meeting online. I know that's not as good as meeting in person, but that's all we can do right now.
Here's how to tell if your anxiety or depression needs a doctor or medication. You need to pay attention to how you are thinking. Is it hard to shut your mind off? Are bad thoughts just running through your head continuously and you can't control them?
Your serotonin level determines how much control you have of your thoughts. If the level has dropped, it gets harder to steer your thoughts in the direction you want them to go. Medications can boost your serotonin level so you can regain thought control.
Your doctor can't tell what you're thinking, so you need to do a self-assessment first and then give the results to the doctor. We have self-assessment checklists on our website that you can use to assess your thinking patterns. The links are below the video.
We also have lots of videos that will help you understand how the treatments work and how to tell if you need them.
If you're feeling down and anxious from any cause, the pandemic is probably making it worse. Don't stay that way. Get help. There are lots of people willing to help you.
We want you to thrive during the pandemic, not just survive. So join our Free Your Mind weekly online video program. It's a great way to grow mentally, spiritually, and emotionally when you can't go anywhere. And you can learn more about it using the links below this video.
We'll talk to you next week about winter depression, but this week, if you aren't feeling well, talk to someone.